Everyone, and welcome to Scorecard 101. My name is Betty Tho, Quality Improvement and Accreditation Program Manager. The Health Department actively uses performance data to improve the health of Cabarrus County residents. We want to know how well we and our partners are performing so we can adjust public health strategies accordingly. This involves the strategic use of performance standards, measures, progress reports, and ongoing quality improvement efforts to ensure we are achieving desired results. The performance scorecards measure our efforts. Part 1, how to access and scorecard components. We will now provide you with a walkthrough of the Cabarrus Health Alliance public-facing website page to get to a scorecard. All live scorecards will be located on the CHA website under its respective topic area. Locate the service area you are interested in. Today, we will be reviewing FCC, also known as Family Support. To access their scorecard, you will scroll down to the bottom. Once you click the Family Support link, it will open up FCC's service page. Scroll to the bottom and select Click Here to access family care coordination data. This will open up another web tab with the FCC scorecard. These interactive scorecards show how well Cabarrus County is doing compared to our desired outcomes. Scorecards display countywide population data and program performance measures that support transparency and accountability. They are built according to the results-based accountability framework and together provide decision makers, stakeholders, and frontline staff with a consistent way to use data to manage performance. We will now discuss components on the scorecard. On the top left corner, a scale is located to display the level of content you intend to view. Moving the scale to the far left will decrease the level of content to only display population accountability and performance accountability. Moving the scale to the far right will increase the level of content to display population accountability, results, indicators, charts, and more. There are 4 icons that are in every scorecard. The green R represents results, a condition of well-being for children, adults, families, or communities. The results we are reviewing is all pregnant women in Cabarrus County will have a healthy pregnancy and delivery. Population accountability is monitored using the yellow I, which represents indicators, a measure which helps quantify the achievement of a result. The indicator we will be reviewing during the presentation is infant mortality rate. The blue P represents programs. In the context of this scorecard, this will be individual programs within the department. The program we will be reviewing within FCC department will be care management for high-risk pregnancy. Performance accountability is monitored using the red PM icon, which represents performance measures, a measure of how well a program, agency, or service system is working. The performance measure we will be reviewing is the percent of priority patients in a non-active OB case status. When you click on the plus icon, you can open up indicators and performance measures. By clicking on the plus sign for the infant mortality rate, the indicator displays a disaggregated line graph broken down by race. I will now hand you over to our epidemiologist, Meji Kuyate.
Thank you, Betty, for providing us with that scorecard overview. I am going to dive a little bit deeper into the scorecards by talking about our different data components. So if we look to the right-hand side, this red box just highlights the 4 column titles that we will see in every single scorecard that we're looking at. Those are the time period, the current actual value, the current trend, as well as the baseline percent change. Now, if we look to the red circle on the left-hand side, it is circled around infant mortality rates, which just highlights that is the indicator that we will be talking about today. Now, if we are looking to the left of that infant mortality rates, we can see a gray box with MH written on that. And all this is referred to as a tag. And tags are used to help highlight indicators that are included in more than one scorecard. So in this particular case, the MH is letting us know that the infant mortality rate indicator is captured both in the FCC scorecard, and you will also see the same indicator in the maternal health scorecard as well. Now, one piece of detail that easily stands out when looking at these scorecards are the red and green arrows. The green arrows and red arrows are either pointing upward or downward, representing either an increase or a decrease in that particular measure. So the red arrow pointing up, that represents an increase in the indicator, and then the green arrow pointing down, that represents a decrease in that specific indicator measure. This column to the left-hand side, the time period column, just lets us know the different time periods that we are reporting data for on this particular scorecard. And as we can see here, we are reporting data from 2018 to 2019. The column representing the current actual value represents the reported rate for that particular indicator that we're looking at. So for example, in 2019, the reported infant mortality rate was 5.9. Now, when we're looking at the current trends column, we can see that there is a decrease, which is represented by that green arrow pointing down, in infant mortality rates in 2019. And looking at the baseline percent change, this column simply just quantifies the overall observed change for the period that we're looking at. So although the current time period that we're reporting on this card is 2019, we're actually capturing data from 2016. So that red arrow pointing up just shows that there's a 4% change in our baseline measure, which was from 2016 to the measure that we're currently displaying for 2019. And once you click that indicator, it opens up a line graph, which just simply shows the trend of whether there's an increase or a decrease for a specific year for that particular indicator. Now, this red circle right here in the center of the scorecard, it just highlights the data source, and this is extremely important whenever we're building these scorecards, that we include the data source, because it lets people know where we're getting this information. And it also serves as a point of reference for anybody else that might want to do a little bit more further research into these particular indicators that we're looking at. So for example, if someone wanted to learn a little bit more about infant mortality rates in Cabarrus County, they can go to the North Carolina State Center for Health Statistics, where they're able to access these infant mortality rate reports, where we're getting our data for the scorecard. And if we look to the right, that 5.9 just symbolizes that the infant mortality rate for 2019 was 5.9 per 1,000 live births. And right here, this circle just highlights a comparison feature of the scorecard. And if you check that, it just kind of goes a little bit more into details about the data that's captured in here. It's showing the different groups that you're comparing the measures for that particular indicator. And right here, we can see that while we're looking at infant mortality rates as a general population measure, we're also able to look at infant mortality rates specifically amongst our white, African American, and our Hispanic residents. Now, when you click the show labels, it gives you the option to show the actual numerical figure for these different trend or the data points. And when you click hide labels, it also hides that. And I'll pass it over to Maddie.
All right, so now I'm going to be talking about part 3, which is all about the notes section on the scorecard. So going back to the home page of the scorecard, we are going to first be looking at the result level. And like we've mentioned before, we're looking at that result of all pregnant women in Cabarrus County have a healthy pregnancy and delivery. And so when you go ahead and click that, it takes you to that results page. And the note section that's included on all the results is why is this important. And we're looking at this just so we're giving people who access the scorecards, as these are public facing, more information about why we're looking to look at this result and why we are measuring it with these indicators. Going back to the home page, now we'll be looking at that indicator of infant mortality rates. So if you go ahead and click on that, it opens up the notes section for the indicators. And this first one we're going to look at is the story behind the curve. And this section contains information that data doesn't capture. And so this is another piece of the story behind the curve of asking why the data looks the way it does, what's the historical context, and really getting to those root causes of that historical context. And then the next section we have are the partners, and just because this is a indicator level at that result level population accountability, these partners will be other stakeholders, programs, and other departments not within CHA, more than likely. Next, we are looking at what works, and this is really answering the question on what works to do better. This is where we can review that story behind the curve and find the parts that point to action, so making sure that we're looking at those causes of the story behind the curve as one pointer to action, as well as those partners, because each partner has plays a role in turning the curve. And so these are useful just because we're able to talk through maybe what has worked in other counties or other communities that are like Cabarrus County, and having that differing of opinion will really allow us to improve population health outcomes by combining the ideas and working towards that continuous quality improvement. The last note section on here is the strategy, and this is where we are talking about putting that talk to action, and this is where you're outlining your action steps and phases that you're going to do to accomplish turning the curve. Now going back to the home of the scorecard, we're looking at performance accountability, and that program being care management for high-risk pregnancies. So if you go ahead and click that one, it opens up the notes section of what we do, who we serve, and how we impact. And so what we do is really just answering the question of the services that that program provides, and then moving forward, we have who we serve. This is filling out information about all the different patients, families, and clients that that program provides services to. And then lastly, we have how we impact, which allows the program to show the ways in which their program makes an impact on those that they serve. As this is that performance accountability, we want to make sure that we're looking at those that are accessing services at CHA. So now looking at the performance measure of percent of patients in non-active OB case status, you'll go ahead and click that, and it will open up note sections that are similar to that indicator level. And the only thing that's different about this one is rather than calling it a strategy, we're looking at the action plan. And the action plan is just really detailing a champion for the specific action items that you decide to do and take action upon. And this is just really important that these note sections may not be filled out when the scorecard goes live on the website, and that's okay, just because these note sections you'll get when you're facilitating that turn the curve activity to improve that population health outcome. And so the last thing we're going to talk about today is how to download this as a PDF. And so in that top right hand corner, you have the PDF button. If you go ahead and click that, a screen will populate, and usually the scorecards look better when you download them in a landscape, and so you'll just want to click that export button. And once you do that, in the lower left you can see that it is into a PDF, so from there you can go ahead and save it, send it, whatever you want to do with that scorecard. And we thank you for your time today, and if you have any questions, please feel free to follow up with us.